At least half of the time spent at the doctor's office is time spent waiting. In fact, the average time in the waiting room is 18 minutes and 13 seconds. Over half of physicians spend less time than this with their patients. This sounds like a recipe for disaster. If patients are waiting even longer than they're with their doctors, they'll likely get irritated. Unfortunately, sometimes this isn't possible to spend more time with patients at all. Doctors already have so much on their plates. But the good news is there's still a way to save your patients. If the time that they spend with their doctors is positive and productive, it will make their wait time seem worth it. In order to make the patient-doctor interaction a positive experience, doctors must effectively communicate with their patients. Hi everyone, I'm Matt Moneypenny, and today I'm going to give you 3 tips to help improve communication with patients. But before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it so that when we post new helpful content, you'll get notified. Have you ever tried having a conversation with someone, but you feel like you can't get through a sentence because they keep interrupting you? No one wants to talk to someone that constantly interrupts you. This sounds like a no-brainer, but don't interrupt your patients. On average, patients only have 11 seconds to explain the reason for their visit before the doctor interrupts them. This makes it seem like the doctor doesn't actually care about the patient's condition and like they're making an assumption about what the problem is in the first place. Yes, doctors are busy, but a patient can't get proper treatment if they can't explain why they're at their doctor's office in the first place. So let your patient speak, then offer professional knowledge after they're finished talking. Next, when you offer your professional knowledge, you need to be careful with the terms you use. You might be so used to explaining conditions that you forget not everyone is familiar with the words you're using. 30% of English-speaking patients are unable to define simple medical terms. This is why you need to use simple language that the general population would understand. It's even more helpful if you ask your patients if they have any questions. They might feel intimidated or embarrassed to ask for clarification, so if you initiate this, they might be more likely to ask. Have you ever been telling someone a story, but they seem to be focused on something else? Maybe they can't peel their eyes away from their phone long enough to even acknowledge that you're talking. Or maybe they're just staring off into space, looking really bored. This can be discouraging for whoever is doing the talking. They'll feel like they're talking to a wall, or they won't be sure if you're listening and they will stop talking altogether. You never want your patients to feel like this. They came to you for help, and it's your job to do that, not make them feel like an inconvenience. This is why it's so important to make eye contact as your patients talk. Not only is it important to make eye contact when they're speaking, but also make eye contact when you're speaking to them. If you don't, it will make them feel like you're just trying to rush through the appointment. Paying attention also helps you notice if they're understanding everything you're saying. Remember when I said to use simple language? If you use eye contact, you'll recognize if your patients seem confused by something you say through their body language. A good rule for eye contact is the 50-70 rule. This means to make eye contact for 50% of the time while speaking and 70% of the time while listening. This shows that you're engaged and care about the conversation. It also won't seem like you're rushing the patient out of the room. Doctors are so busy, so it isn't always possible to spend more time with patients. This sometimes leaves patients waiting longer than the time they spend with the doctor in the first place. But through effective communication and interactions with the doctor, you can still make the waiting seem worth it, and it will improve the patient's satisfaction with their overall experience. If you'd like to learn more information about improving communication with patients, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.